Hello and welcome to Case of the Day. I'm Dr. Croley, and today we're going to discuss actually a eye disease where I've recently had two patients come in with this problem, and since it's not the typical thing that happens, we thought I would go over that. So I've had two patients in the last 2 weeks who come in with herpes zoster, or shingles, commonly known as shingles, along their forehead and face on one side, and they both have had the actually zoster vaccine. So now this is about the fourth or fifth person that I've actually seen in my office who's had actually the vaccine to prevent the zoster from happening, who actually still got it. And so I thought we would cover a little bit about that and go over that today. So herpes zoster, or shingles, is caused by the same virus that causes chickenpox. And so before you can get shingles, you have to have had chickenpox in your lifetime. And so once you've had chickenpox, that virus lives in the nerve cells of your nervous system for the rest of your life. And through a variety of things, you become ill, or you become weakened, or even during holidays or sad times, things that just typically throw your immune system off can let this shingles pop out, and then you get this rash, and it follows the pathway of a nerve, and so it comes around the side of someone's trunk or chest, and in the case of the face, it will follow the tract of the fifth cranial nerve, which supplies sensation to the face. So typically, more often, it does the forehead, sometimes and eyelids, which is the first division of the fifth cranial nerves. Occasionally I've seen it on the cheek, and very rarely down on the jaw area, which is a different division of the fifth cranial nerve. And so this typical rash where this little vesicle pops up and then opens up, and you get this sort of scaly rash that happens, and it oozes for a while and then slowly dries up. And if interesting, as far as the eye goes, it affects the lids and the forehead and can get on the eyelid and the brow area. But if you get a spot along your nose, then that means there's a very good chance that you're going to get it in the eye itself. So that is a significant sign if you get a lesion on your nose as well as the forehead. And so the treatment is we put people on systemic antiviral medications, sometimes prednisone. Then I also typically will put people on some cortisone and antivirals in their eye, just as a preventative thing, and that's the usual treatment. In the case of these two ladies recently, in the last couple of weeks, they actually have had the vaccine. So the vaccine is recommended for people over age 65 because there's a higher incidence as we get older. Their immune system weakens, and then it pops out more likely to happen. Unfortunately, the vaccine's not a guarantee. So there are still people who still get a shingles episode after the vaccine. So the vaccine certainly, I think, is very strong evidence that it decreases your risk of getting it, but it does not 100% stop you from getting it. And at least so far, the cases that I've seen are of the less severe type of the ones I've seen. So maybe it's also allowing you to have a milder case of the shingles by having the vaccine. So if you are considering over 65 and considering getting the vaccine, I would highly recommend you talk with your medical doctor about what they recommend, and you certainly can get the vaccine in their office. So if you have any questions about shingles or herpes zoster, we'll be happy to try to answer those through the website. If not, may God grant you healthy eyes and great vision.